You pay hundreds of dollars every month for health insurance, maybe even thousands. Then you go to the doctor and you still have to pay a copay. You get some lab work done, and a few weeks later, another bill shows up. And you start wondering, what exactly am I paying for? And maybe an even bigger question is, why is healthcare in America so expensive? Hi, I'm Dr. Okoro, and welcome to Medicine Unplugged, where we make medicine and healthcare easier to understand. No complicated medical jargon, no hype, just practical, evidence-based conversations about your health and healthcare. Let's get into it. After more than a decade of practicing medicine, I can tell you that the answer to this question is more complicated than most people realize. Because when people talk about the high cost of healthcare, everyone seems to have someone they want to blame. Some people blame doctors, some blame hospitals, some blame insurance companies, some blame pharmaceutical companies, and some blame the government. But the reality is, American healthcare is not one system. It's a massive network of doctors, hospitals, insurance companies, pharmaceutical companies, pharmacies, employers, government programs, technology companies, and middlemen. Every single one of them play a role in determining how much you eventually pay. So today, we're going to unplug the system and talk about where your healthcare dollars actually go. Let's start with something that will be completely unacceptable in almost any other industry. Imagine walking into a restaurant. You sit down, you order dinner, but there's no price on the menu. So you ask the waiter, how much is this going to cost? And the waiter says, well, that depends. Depends on what? It depends on who your employer is. It depends on which insurance company you have. It depends on which insurance plan you selected. It depends on whether you've met your deductible. It depends on whether the restaurant is in your network. And it depends on what price your insurance company negotiated with the restaurant. Then 3 weeks after eating your dinner, you receive 5 different bills. One from the restaurant, one from the chef, one from the person who brought your food, one from the company that owns the building, and another bill from someone you've never even heard of. You would think the entire system was insane. But in healthcare, we've somehow accepted this as normal. And that brings us to one of the biggest problems with American healthcare. Nobody really knows what anything costs. You might ask your doctor, how much is this MRI going to cost? And sometimes your doctor doesn't know, because the answer may depend on where you go, what insurance you have, whether you've met your deductible, and what price your insurance company negotiated with that particular facility. That's the first major problem. Healthcare has an incredibly complicated pricing system, and complexity costs money. Now let's talk about something I understand very well, running a medical practice. Let's say you go to your primary care doctor, you spend 20 minutes with your physician, and your insurance company is billed $200. A lot of people naturally assume, my doctor just made $200 spending 20 minutes with me. But that's not how it works. First, the amount billed is not necessarily the amount paid. Your insurance company may have negotiated a completely different rate. Then, the medical practice has expenses: employees, receptionists, medical assistants, nurses, billing staff, office managers, rent, utilities, medical supplies, malpractice insurance, electronic medical records, cybersecurity, compliance costs, licensing fees, credentialing expenses, and then there's the cost of actually trying to get paid. Yes, healthcare has created an entire industry around getting paid for healthcare. Think about that. A medical practice provides a service. Then someone has to submit a claim to the insurance company. The insurance company reviews the claim. Sometimes they pay it. Sometimes they don't. Sometimes they deny it. So now, someone has to figure out why it was denied, correct the problem, resubmit the claim, follow up with the insurance company, and hopefully months later, the medical practice finally gets paid. Imagine running a restaurant where someone eats dinner today. You submit the paperwork asking to be paid, and 3 months later, someone tells you, we've denied your payment because you filled out box number 17 incorrectly. Welcome to healthcare. Now let's talk about insurance. Health insurance was originally designed to protect the people from major financial disasters. But today, insurance is involved in almost every part of healthcare. You want a medication? Insurance may need to approve it. You need an MRI? Insurance may need to approve it. Your doctor recommends a procedure. Insurance may need to approve it. This process is called prior authorization. And prior authorization is one of the best examples of how administrative complexities increase healthcare costs. Here's what happens. Your doctor decides that you need a medication. The prescription is sent to the pharmacy. The insurance company says, no, we need more information. So now someone at your doctor's office has to complete paperwork. The insurance company reviews it. Maybe they approve it, maybe they deny it. If they deny it, your doctor may need to submit an appeal or provide additional medical records or schedule a conversation with someone working from the insurance company. All of this requires time. All of this requires employees, and all of this costs money. And here's the irony. We have created massive administrative systems to control healthcare spending, but those systems themselves cost billions of dollars to operate. Now let's talk about hospitals, because this is where healthcare bills can become truly shocking. You go to the emergency room, you receive treatment. A few weeks later, you get a bill for thousands of dollars. Why? First, hospitals are incredibly expensive organizations to operate. A hospital operates 24 hours a day, 7 days a week. It needs physicians, nurses, pharmacists, laboratory technicians, radiology technicians, respiratory therapists, security, cleaning staff, information technology, medical equipment, operating rooms, emergency departments, intensive care units, and so much more. But there's another issue. Hospitals also treat patients who cannot pay. And when hospitals provide care that is never paid for, the costs don't simply disappear. Some of those costs eventually get shifted elsewhere in the healthcare system. And this is one of the reasons hospital pricing can be so difficult to understand. The amount a hospital charges, the amount an insurance company negotiates, the amount Medicare pays, and the amount a patient eventually owes can all be completely different numbers. Now we have to talk about prescription medications. Developing a new medication can take years. It requires research, clinical trials, regulatory approval, and enormous financial investment. Pharmaceutical companies argue that high drug prices help fund innovation, and there is some truth to that. Developing new medications are expensive, but here's where things get complicated again. The prescription drug system doesn't just involve the company that makes the medication. It can also involve wholesalers, pharmacies, insurance companies, and pharmacy benefit managers, often called PBMs. And once again, we have another complicated system with multiple organizations negotiating prices and taking a portion of the healthcare dollar. The result? The patient standing at the pharmacy counter has absolutely no idea why their medication costs $10 one month and $300 the next. Now, here's something interesting. Technology usually makes industries more efficient. Banking became faster, communication became faster, shopping became faster. But healthcare technology, that's a little bit more complicated. Electronic medical records were supposed to improve healthcare, and in many ways, they have. Doctors can access medical histories, review lab results, send prescriptions electronically, and communicate with other healthcare professionals. But technology has also created enormous expenses. Medical practices and hospitals spend huge amounts of money on software systems, cybersecurity, data storage, compliance, and technical support. And doctors now spend significant amounts of time documenting everything that happens during a patient visit. Why? Partly for patient care, but also for billing, for compliance, insurance requirements, and legal protection. Once again, complexity creates costs. Now let's address something I hear frequently. Doctors make too much money. That's why healthcare is expensive. But physician compensation represents only one portion of total healthcare spending. And there's something else people don't always consider. Becoming a physician can take more than a decade of education and training. There's medical school, residency, sometimes fellowship. Many physicians begin their careers with significant student loan debt, and physicians are responsible for making decisions that can literally determine whether someone lives or dies. Now, does that mean there aren't problems with physician compensation or financial incentives in healthcare? Of course not. There are problems throughout the system, but if every doctor in America suddenly agreed to work for dramatically less money tomorrow, healthcare will still be incredibly expensive because the cost problem is much bigger than the physicians. So, who is actually responsible? Here's the frustrating answer. Almost everyone and no one. Doctors operate within the system. Hospitals operate within the system. Insurance companies operate within the system. Pharmaceutical companies operate within the system. Employers operate within the system. The government operates within the system. And patients are stuck trying to navigate all of it. The American healthcare system wasn't designed all at once. It developed over decades. One policy, one regulation, one insurance product, one hospital system, one pharmaceutical company, one technology platform, and at a time and eventually was ended up with one of the most complicated healthcare systems in the world. So what can you actually do? First, ask questions. Before having a non-emergency procedure, ask, what is this going to cost? Is the facility in my network? Is the doctor in my network? Is the laboratory in my network? Do I need prior authorizations? Is there a less expensive alternative? Second, understand your health insurance. Know your deductible. Know your copay. Know your co-insurance. Know your out-of-pocket maximum. These terms may be boring, but understanding them can save you thousands of dollars. Third, don't be afraid to ask about medication costs. Sometimes there are generic alternatives. Sometimes there are manufacturers' programs. And sometimes paying cash may even be less expensive than using insurance. And finally, one of the best ways to reduce your long-term healthcare costs is to invest in your health before you become seriously ill. Manage your blood pressure. Manage your weight. Exercise. Get adequate sleep. Don't smoke. Complete your recommended cancer screenings and establish a relationship with a primary care physician. Preventing disease or identifying it early is often far less expensive than treating advanced disease. So, why is healthcare so expensive? There isn't one answer. Healthcare is expensive because we have built an incredibly complicated system, a system with confusing prices, massive administrative costs, insurance requirements, expensive technology, hospital infrastructure, prescription drug costs, and layers upon layers of organizations between the patient receiving care and the people providing it. And this is one of the reasons I started Medicine Unplugged. Healthcare affects every single one of us, but too many parts of the system remain unnecessarily confusing. My goal is to help you understand medicine, healthcare, and the business behind it, without the medical jargon and without the politics. So if there's something about healthcare you've always wanted explained, leave your question in the comments, because there's a good chance you're not the only person wondering. I'm Dr. Okoro, and this is Medicine Unplugged. I'll see you in the next episode.